Good evening, Whatcom County. My name is Erica Lautenbach. I'm the director of the Whatcom County Health Department. Thank you for joining us tonight while we give you an update on vaccine, and I'm joined by partners as well. I also want to thank our KGMI listeners for joining us in this important community conversation about vaccine. Tonight, I'm joined by Shannon Hardy, the COO of Unity Care Northwest, Dr. Rodney Anderson, the President and CEO of Family Care Network, and Dr. Jim Boxler, the Chief Medical Officer of Peace Health. Could we advance to the presentation, please? Thank you. I first want to share a bit of general information about vaccine, and then I will turn it over to our partners to share more specific information about what they're experiencing in their clinics. So what's happening now? Well, we know that more people are eligible for vaccine as of yesterday, and some of the new folks that are eligible, that Phase 1B Tier 2, include high-risk workers in certain settings, such as grocery store workers, food processing facilities, public transit, agriculture, and a number of other facility settings. Also eligible are people age 16 and older who are pregnant or have a disability that puts them at higher risk of severe illness from COVID-19. We also learned this afternoon that the next advancement of phases will begin a week early on March 31st instead of the following week, and many more individuals will be eligible when both Phase 1B Tier 3 and Phase 1B Tier 4 go into effect on March 31st. We also continue to vaccinate our Phase 1A workers, the high-risk healthcare workers and home healthcare workers, and Phase B Tier 1 individuals, including 65 plus. In terms of vaccine allocation, we estimate for the weeks of March 22nd and March 29th, so next week and the following week, that we won't see any significant increases in doses for either of those weeks. However, we do see that we will be able to anticipate receiving about 3,500 to 3,600 first doses each of those weeks. And vaccine appointments are continuing to be limited for the next 3 weeks. Those doses that I mentioned, that 3,500 to 3,600, do not include all of the various programs where federal agencies provide vaccine directly to, first, our retail pharmacy programs, our large chain pharmacies, and second, to our federally qualified health centers, which are also receiving direct doses from the federal government. It doesn't also include the doses that our Lummi Nation and Nooksack Tribe are receiving from the Indian Health Service, and we're very grateful for the efforts that they have put in to help get some of our high-risk individuals and populations vaccinated as well. So that is just our allocation from the state, and that's just first doses. So we will learn more in the coming weeks about how the vaccine doses will look and determine whether or not they will be increased. And one thing to note, we have been receiving week by week the number of doses, and some of that has been pretty variable. 1 week we received over 12,000 doses, and the following week about 3,000. So while these aren't high numbers and we will continue to be limited in appointments, this does help in our planning efforts to be able to have some predictability for scheduling purposes and staffing for both our clinics, pharmacies, and for our community site. So for those of you who are eligible or wonder if you're eligible, there are different ways that you can find out how to get vaccinated and determine your eligibility. First, if you go to findyourphasewa.org, You can find out by answering a few survey questions about your age, your risk factors, your employment, etc., whether or not you're eligible under the current phases. And knowing that there were many more people that became eligible just yesterday, that's a good tool to determine if you're one of them. In order to find a vaccine provider, go to covidvaccinewa.org, and that has a vaccine locator tool. So you can learn what clinics and pharmacies have available vaccine and make an appointment. You can also make an appointment with your healthcare provider that you see for a regular service, or a vaccine locator provider. Alternatively, you can call the Washington State COVID-19 hotline by calling 1-800-525-0127. That's 1-800-525-0127 for assistance in determining your eligibility and availability of vaccine in our area. Now, this is a little bit difficult for our radio listeners, but I'm going to do my best to try to describe this infographic in front of you. This is also updated weekly on Tuesdays on our Whatcom County Health Department website under the Vaccines tab. What this infographic shows is sort of a check on where we are in terms of vaccinating our population. This week, we anticipate receiving 5,710 doses through the Washington State Department of Health. We do not anticipate receiving federal doses to our federally qualified health centers, who are Unity Care Northwest and CMAR in Whatcom County. And we do not yet know what the doses allocated for our retail pharmacy providers are from the federal government, but we do generally learn that within a week of those doses being allocated. In terms of sort of the overall picture of the number and percentage of people who've at least received a first dose or received their Johnson & Johnson dose, over 48,000, and to be exact, 48,311 as of earlier this week have been vaccinated, at least received one of their 2 doses or have received the J&J. That represents 21.44% of the Whatcom County population. Those who are fully vaccinated are 23,629 individuals in Whatcom County, and that's about 10.5% of our Whatcom County residents. It's worth noting, however, that is the overall population. So that also includes people who are younger than 16 who are not eligible for any of these vaccines currently. And it also includes many who are not yet eligible. So this next slide shows where we are in terms of the percent of people who are eligible that have received at least 1 dose of the vaccine. And that is really encouraging. We are now at 72% of residents who are eligible for Phase 1A and Phase 1B1 having received their first dose of COVID-19 vaccine. So we are getting closer and closer to that mark of 100% vaccination on those who are currently eligible. Obviously, with the new changes and more people being eligible as of yesterday, this chart will change as we reset and see that more people are eligible and we have more work to do. But we are making good progress in our community on getting folks eligible and vaccinated. I'm going to turn it over at this time to Shannon Hardy, the COO of Unity Care Northwest, who will talk about our collaborative community vaccination center. Thanks, Shannon.
Thank you, Erica. Yeah, good evening, everybody. So the last town hall we had, I was really happy to introduce that a group of healthcare organizations in Whatcom County had partnered together to form a community vaccination center for Whatcom County, knowing that each of us individually as healthcare providers could not meet the full need of the community, and knowing there was a lot of folks out in Whatcom County who either have providers that aren't vaccine providers or do not have a primary care provider in this community. We wanted to form a community vaccination center. So that partnership includes Whatcom Unified Command, the Whatcom County Health Department, Peace Health, Family Care Network, Whatcom Community College, Seymour Community Health Center, Hoagland Pharmacy, my organization, Unity Care Northwest, and it's being hosted by Bellingham Technical College at their facility, and they're helping to staff the site as well. I'm very pleased to announce that we have now opened the site, and we held our pilot clinic on Saturday, March 6th, where we vaccinated 240 folks with Pfizer vaccine. We ran at about a 40% pace that day to test our systems and make sure that everything was operating correctly. And it worked very well. We got lots of wonderful feedback from the patients that we served, and it primarily focused on 1A healthcare workers and some 1B1 patients over 65. Because of that successful pilot, we then had our official launch last Saturday, March 13th, where we vaccinated 391 of our Whatcom County friends, families, and neighbors with Johnson & Johnson vaccine, the 1-dose shot. That went extremely well. This weekend, we're also hosting another community vaccine clinic at BTC, where we'll do 400 Moderna vaccines. So we'll continue to operate every Saturday through the month of March. And again, a lot of what our volumes are dependent upon vaccine availability. It's really important that for this community vaccine center that we're adding capacity and access in Whatcom County and not diverting vaccines away from other providers in our community that are also vaccinating patients. So we'll continue to grow and ramp up hours as we get more vaccines available. In April, we actually hope to expand to doing both Saturday and Sunday clinics. And if we have enough vaccine, we'll do 800 each of those days per weekend. To make an appointment, you can find us at pretmod.doh.wa.gov. But also for those who don't have access to technology or who are uncomfortable navigating technology or who are not English speaking, you can also call the Department of Health Vaccine Hotline at 1-800-525-0127. So we continue to assess our demand for vaccination, the gaps in access, capacity, and we'll continue to consider other ways to improve vaccine access. But we're really excited, and we're really hoping that once we're able to fully ramp up, that we'll be doing 4,400 vaccinations per week by doing additional clinic days and hours throughout the week. We expect that ramp up will probably really hit towards the end of April and early May when vaccines are much more likely to be available, and also as the eligible patients, the criteria widens for people to get vaccines. Okay, so next I'm going to go ahead and transition to the update for my organization specifically. As Erica mentioned, besides being the chair for the community vaccine clinic, I'm also the chief operating officer for Unity Care Northwest. And so I'll give a little update about what we've done so far. So we've administered 2,584 doses so far, both prime and second boost doses. Our vaccines have been Moderna and Pfizer, and we've done them at both our Bellingham and our North Whatcom sites. We've been vaccinating eligible patients, staff, and community members in 1A, which is healthcare workers, 1B1, which is 65 years and older, as well as the schools, teachers, through K through 12. We've been partnering with the Bellingham School District, with the Whatcom Senior Centers, and other 1A groups to get healthcare workers vaccinated and other essential workers that fall within the eligible categories. We've also really been focusing on working with our homeless population, with folks that are vulnerable populations, and I'll talk about that a little bit later when we get into the question and answer period. How to get more information or how to make an appointment with us. Basically, we will be reaching out to you. We are keeping track of all the eligible populations and are running reports to identify folks that fall into the eligible categories. And we will be sending you an email, a text, or a phone call to help you schedule. And you'll be able to schedule either by phone, and we're also piloting a new online scheduling system as well. It's really been exciting to watch at our organization. You know, we're an organization of about 300 employees, so we're not very large. And we operate medical, dental, behavioral health, and pharmacy services so to our patients. And at the same time, we're trying to also run vaccine clinics and contribute staff to our community vaccine centers. So it's been stretching our resources pretty thin. But I will also say that our staff is so motivated and inspired to do this work. I think everyone knows and understands that this has been a really hard year for our friends, family, and neighbors. And we just want to get to the other side of this pandemic and know that vaccines is the answer to that and also to saving lives. So we've had really great cooperation. We've had our MAs and nurses, but we've also had medical clinicians, our dentists, pharmacists, and even our CEO have been vaccinators in our organization. Our front desk, our outreach staff, medical billers, and many others have stepped up to volunteer during these day-long clinics. And again, while we're still operating our regular services to folks, to patients, and also supporting the community vaccine clinics. So we're very proud of our staff. And while this is exhausting work, I would say that everyone probably feels very rewarded. I frequently tell folks at the Community Vaccine Center and at my own organization that I've been in healthcare for 32 years. And as much as I think I've made contributions throughout my career, that I know I will look back and know that this was the most important one that I made, and to help my community, to help my friends, family, and neighbors to get to the other side of this pandemic. So it's really an honor to serve Whatcom County through this. At that, I'll hand it back to Erica.
Thanks so much, Shannon. We are so grateful for partners like Unity Care Northwest and the heart that you bring to this work. I think we all just feel really invested in making sure that our community can return to some sense of normalcy following this pandemic, and vaccine is certainly the answer to that. I want to next go to Dr. Jim Boxler, the Chief Medical Officer of Peace Health Clinics, and give him a chance to talk about what Peace Health is doing and all the significant effort they're putting in to vaccinating our community.
Well, thanks, Erica. We are, like Shannon, very excited to be a part of getting us through this pandemic. Peace Health, because we have the only hospital in the area, we started vaccinating 1A providers right from the start, which was great. We transferred many of the things that we learned while doing the 1A providers over to our community clinics, which started at our Cordata building and our pediatric clinic, and now is at the Health Education Center. As you can see from our numbers, we've actually done a total of 21,466 people. This was actually of a couple of days ago. That's a couple thousand more now after the last 2 days, I'm hoping. Our maximum capacity, we're shooting for about 1,000. We've actually done more than that a couple days, but it gets a little bit crazy for our people, so we're trying to keep it to 1,000. The days that we're doing it, we've been a little bit sporadic, but we're actually confident over the next several weeks to hopefully months, we'll be 5 days a week, Tuesday through Saturday. Tuesdays and Thursdays are later days, starting at 10 and going to 7, so we have evening hours, and then every Saturday, so we're trying to give people chances to get in off hours. We are administering mostly Pfizer, although we have done a lot of Moderna early, but we're trying to concentrate on Pfizer because since we're connected with the hospital, they have the ability to do the ultra cold storage. And so we're trying to move more to Pfizer, but we've been doing both Pfizer and Moderna. So we are vaccinating all people in eligible groups. Same with Unity Care Northwest. We started with healthcare providers. We moved on to our 65 and older, and now we are into the 1B2 high-risk critical workers and those with disabilities who are 16 and above. We also are really pleased to be working with a variety of community partners who are helping us to reach out to groups in our communities that may have more difficulty accessing these clinics through some of the technology and phones that we've been using for scheduling, and who may have some cultural difficulties coming through, either language or other cultural things. So we are setting aside time on some of our evening hours and on Saturdays for those groups, that Spanish speaking, Punjabi speaking, other groups that we've partnered with to have members from their community come into the clinic, be with them, help guide them through. And we're really excited. Last week we had over 500 people from those groups come through, and we're continuing that and committed to continuing to work with our community partners to get people in who really, really need protection from this disease. The next is we are actually very excited about some things that we've rolled out this week. Prior to this week, we were contacting patients through our medical record who did meet the criteria. But with the new criteria, we know that we can't tell from our medical director who has a high-risk profession, where they're working, what their occupation is, what their family status is. And we've been having a real hard time getting people by calling them. So we have opened up to direct scheduling through our website. That you can do it on peacehealth.org, and you can do online scheduling. It's actually quite easy. Ask a few questions to make sure that you're ready and that you're in the eligibility group, and then allows you to schedule up. They also have a phone number that people can call to get in, and we're continuing some outreach efforts for patients that we know are at high risk. So this has been really exciting. We just rolled it out this week. Within the first 18 hours, we had over 700 people go online and schedule their own appointment. And so far, it's been working out really well. There may be some hiccups for people if they come on and they transpose some numbers or misspell something in their name and our records don't match with them, but we have ways to fix that when they get to the clinic. So we're very excited to let everybody know about that. And so that's it. my.peacehealth.org, or there's a variety of links out on social media and stuff that'll take you right to that scheduling area. It's really easy. Even I could find it, and I'm a doctor. So
Thanks so much for that, Dr. Boxler. Really, really helpful to hear. And I know our Whatcom County executive is actually at Peace Health tonight with the Punjabi community that you specifically outreach to. And that's just a great partnership and effort there. Last, I want to turn it over to Dr. Rodney Anderson, who's the president and CEO of Family Care Network, to give us a little overview of what's happening in your organization with vaccine.
Great, thanks, Erica. I'll try to keep these comments relatively brief. Our approach has been very consistent with what we've heard from Unity and Peace Health, vaccinating essentially all eligible patients based on the expanding eligibility criteria for the states. The challenge for Family Care Network, I think, has been a shared challenge for many organizations in the community. It's just the limited allocation of vaccine. We obviously back in December tried to ramp very quickly to create extensive capacity, but it's been the supply that's really been the lagging factor for us. And so there does seem to be some light on the horizon. We got more doses allocated this week than we have since this started, which is highly encouraging for us. We were actually able to open 1,000 appointments today for scheduling, which is also a high for us. In total through today, as you can see by those numbers, we've administered just under 4,000 vaccines in total. We have stuck with the Moderna and Janssen or Johnson & Johnson vaccines. Early on, that was due to limitations with the ultra cold storage freezer. And then there has been some coordination amongst community groups determining who would request which vaccines. And then we've also found, interestingly, that we are able to often extract an extra dose from the vials. So we are actually administering about 10% more than our sort of state allocation just based on these extra doses. And I'm kind of proud to report we haven't actually wasted a single dose of those that have been supplied to us, including those extra doses. So have, again, tried to be good stewards of the limited resource that the vaccine has been. So what's coming next for us? We are currently administering vaccines through 3 of our outpatient clinics with what we aim for some good geographic spread there. So 2 of those are north of Bellingham. For Bellingham itself, the drive-through location, which we opened at the corner of James and Sunset, the old Germs Funeral Home, with the vision of actually running that 6 days a week, 10 to 12 hours a day. Again, we've been largely limited by vaccine supply to get that kind of up and running to full capacity. I did mention the focus on Moderna and Janssen, and then we have been trying to obviously collaborate with the health department and other providers in our community to ensure equitable allocation and to ensure access to the vaccine. I can share a little bit more, Erica, with the questions around how to actually schedule appointments through Family Care Network.
Great, great. Thanks to you all. I think there's a couple of themes I hear, and this is not unique to the partners here before you. We have 48 provider sites now in Whatcom County. There are a lot of providers that have stepped up to and really made sacrifices, changed staffing plans, ramped up staffing in order to make sure that our community is well prepared when there is more vaccine. That's sort of the second theme that we continue to hear is the supply has limited our ability to really move forward in getting as many people as we would like, which is everyone in Whatcom County vaccinated. That is our limiting factor, and it's been frustrating for the public. It's been frustrating for all of us. But we recognize that within probably the next 4 to 6 weeks, that will change, and there should be an abundance of vaccine to match the expanded eligibility. But as we wait, it's great to hear stories about continued focus on equity, really trying to make sure that we're meeting the needs of the most vulnerable and the most at risk for severe illness and death if they contract COVID-19. And I want to thank these partners here, but also all of our partners in Whatcom County that have really stepped up to make sure that our community is well equipped with vaccine and providers, and we can get people quickly vaccinated so we can get back to not normal, but better than normal. That's what we hope for. So with that, I want to move forward with some questions that we've received in advance. And I think the first question we've for the most part answered, but I want to make sure that I give Dr. Anderson the chance to answer this question. I will just reiterate. So the first question is, I'm eligible or will be eligible soon. How do I make an appointment? And both Shannon and Dr. Boxler went through that appointment process, not only for their own individual clinics, but also for the partnership, the Community Vaccination Center. And I just want to reiterate for folks a couple of key broad points. So first, the covidvaccinewa.org website, which allows you to locate vaccine, make an appointment with those entities that are in the PrepMod system. Another key phone number is that DOH hotline, that state hotline, which is 1-800-525-0127. And for our local collaborative site, on days when there is available vaccine, if you do not have internet access, cannot speak English proficiently to be able to get into the system, or have other barriers specific to accessing the PrepMod software, you can call 360-778-6075 to get assistance and get an appointment over the phone. So I know that both Shannon and Dr. Boxler shared a bit of information about Unity Care and Peace Health respectively, but I want to give Dr. Anderson the opportunity to talk about the scheduling process for Family Care Network.
Perfect. I should have probably done that during the slides. But so there's kind of two avenues to schedule through Family Care Network: online self-scheduling, and then via telephone if you have technology limitations. So the online website is covidvaccine.fcn, as in Family Care Network, .net. So covidvaccine.fcn.net, and then the telephone number 360-733-1342. And then we've committed, as we get notification each week of supplies and those of additional vaccines, and those vaccines arrive, we try to give 24-hour notice to patients that the option to schedule will come on, available at a certain time. And at that time, we turn on the self-scheduling through the website and turn on the phones as well. And we know that scheduling through the phone is a little bit slower, so we allocate a certain number of appointments that are reserved just for phone calls. And so, again, information around when appointments are available, website, social media, emails, and then you can also just call that scheduling phone number and we can give you updates as to when the next scheduling opportunity will be.
Great, thank you. And I think it's important to note, as you mentioned, Dr. Anderson, that We all as providers learn of our individual allocation from the state on a weekly basis. So if you're frustrated that you can't make an appointment 2, 3, 4 weeks out, it's because we don't know if vaccine will be available based on the supply. So that's the reason why it's week by week. Again, we're hopeful that that will change in the next 4 to 6 weeks, but for now, that is the limiting factor, and that's why there's some limitations in our systems as well. So the next question is, again, for you, Dr. Anderson. I've received my first dose. Can I get my second dose anywhere? Does it matter how far apart the first and second doses are if I need to reschedule my appointment?
Yeah, it's another good question. So just to reiterate, there are 3 vaccines currently approved. The first one is the newest one is the Johnson & Johnson or Janssen vaccine. That is a single dose vaccine, so there's no second dose needed on that one. The other 2 are the Pfizer and Moderna vaccines, and they have different intervals for the second dose. So for the Pfizer, the interval between first and second dose is supposed to be about 21 days or 3 weeks. There is a little leeway there. It doesn't have to be exactly 21 days. And for the Moderna vaccine, second dose is recommended 28 days later or 4 weeks later. And again, a little bit of leeway and flexibility there. I probably can't overstate the importance of trying to get that second dose. We've been hearing rumors that folks are fearful to get the second dose because of side effects. It is worth remembering the reason why there is a second dose is to get you up to kind of full immunity. And so that second dose is super important to actually get you the level of protection that the vaccine is intended to provide. And the CDC a number of weeks back actually created one additional recommendation, which was that the second dose actually can be stretched out a little further than those intervals if need be, based on limited supply. And so they said as far out as 6 weeks or 42 days after your first dose, you still can get the second dose. So again, if you miss that 21 or 28 day window, don't hesitate, get that second dose as soon as you can thereafter, and you will still receive the benefit of the boosted immunity.
Mm-hmm. Great. Thank you for that. I often get the question, and probably most of you or all of you do as well, is which vaccine should I receive? The truth is, and what my response is, whichever you can get at once you're eligible. They're all incredibly effective and safe vaccines, and we're very fortunate to have 3 different options and hopefully additional pipeline with supply for each of those vaccines. The next question is for you, Dr. Anderson, again, and it's related to the last question, but why do some people have trouble getting their second dose of Moderna and Pfizer, and what can be done about this?
Yeah. So we recognize that for a handful of patients, the location where they get their first dose, they are unable to get their second dose. Maybe they had traveled outside of the county or something, and they're simply not able to get back to that same location. Now, interestingly, the state in the vaccine allocation does try to match first and second dose allocations to individual groups, and they actually track that. So when we report back to the state, we actually tell them how many first dose, or what we call prime doses, and how many second dose or booster doses. So the ideal scenario is always to get your second dose from the location where you got your first dose. But if that is not feasible, it is still important to try to get that second dose. And so, reaching out to your healthcare provider to ask what resources are available. I know for Family Care Network, we've certainly tried to work those patients in to get their second doses. The state has prioritized providing second doses to be sure that people get that full immunity boost. And then if I could add one other comment, just building on Erica's statement around vaccines, which one should you get? There's been some misinformation out there about the effectiveness of these vaccines. And effectiveness can be defined a bunch of different ways, but really what matters from an effectiveness perspective is how effective is it at keeping you from getting really sick, ending up hospitalized, or dying from COVID. And the take-home message is all 3 vaccines are amazingly, amazingly effective at that threshold. And so I would wholeheartedly echo Erica's statement, get whatever vaccine you can as quickly as you can get it.
Thanks for that. The next question I have is for Shannon Hardy. How do I know if I'm a high-risk critical worker?
Yeah, so the groups included as high-risk critical workers in phase 1B2 are people who work in an enclosed space around other people and cannot maintain physical distance. They're at high risk of getting or passing on COVID-19 because of risk factors associated with their jobs. And those can be things like the work setting. Are they working outside versus inside? Their proximity to coworkers or customers, the type and number of contacts they may have with others, and the duration. How much time are they in contact with the public or coworkers? Right now, the only occupations listed in the Department of Health's guidance for Phase 1B2 are those that work in agriculture, fishing vessels, food processing facilities, grocery stores, food banks, prisons, jails, and detention centers, courts, public transit, and first responders who weren't eligible in Phase 1A.
Thanks for that. I appreciate that. That's a very helpful answer. And my next question is for you as well, Shannon. Restaurant, bar, food service workers have highly public-facing jobs, and restaurants are starting to increase capacity. When will they be eligible to be vaccinated?
Yeah, I know this is one we hear a lot of around the community because, as we all know, restaurants and restaurant workers are in close proximity to customers as well and are public-facing. Right now, restaurant and other food service workers are not included in Department of Health's Phase 1B2 group. The Department of Health established criteria based on the risk of COVID infection, as described in the previous question that kind of answered a little bit about who falls into that. There are really a lot of factors to consider when thinking about who should get vaccinated first. And, I don't envy the Department of Health in trying to make those decisions. They're not cut and dry choices. It's really impossible to decide if a restaurant worker should get vaccinated before or after someone with, say, COPD or cancer. But that's the kinds of decisions that our state is kind of being faced with making right now. There's also many other workers in public-facing jobs. There's barbers, hairdressers, plumbers, electricians, workers in other retail settings who are also not yet eligible and will need to be patient a little bit longer, which is difficult because they're also public-facing and deal with a lot of folks in close proximity. What we just found out this afternoon, though, is that Governor Inslee did announce that restaurant workers will be eligible starting on March 31st. So all adults will be eligible in less than 6 months as well, starting on May 1st. So I guess a couple things I would say. One is it's great that restaurant workers, just a couple more weeks, and they'll be eligible to start receiving vaccinations. And then there's this commitment to have vaccines for all Americans by May 1st. And so it's hard to wait. We know that. We all want to help you get vaccines as fast as you can, but we're getting close. And so hang on and be patient just a little while longer.
Yeah, thanks for that. And you said we'll all be eligible in 6 months, and I just want to clarify 6 weeks. No, I know, but for those waiting, 6 months is a big difference to 6 weeks. So on May 1st, yes, on May 1st, all Americans over 16 will be eligible for vaccine. So it is a race to make sure that we get the highest risk populations vaccinated before that opens up and continues to create more eligibility and hopefully more availability of vaccine to meet that demand. The next question is for Dr. Boxler. Why is it so difficult to get through to the Peace Health Clinic to make appointments? Are you doing anything to address the logjam of calls? I'm sorry, that's a...
It's okay.
What are you doing, Dr. Boxler?
Well, it's a great question because during the first week when eligibility opened up for all 65 and older, we did get swamped with phone calls. Mm-hmm. We did a couple of things. We actually separated our COVID line that people were calling that was swamping us from our regular line. So our regular clinics should be as easily accessible now as they ever are. And so that should be fine. We also heard a lot about our on-hold message being repetitive, and people already knew it and they could recite it by heart. And so we've done some steps so they don't have to hear that as much. So hopefully people will not be having that difficulty. The other big thing, which I said when I was going through it, is we've opened up an online scheduling system so that we are thinking that the vast majority of our vaccine clinic visits will be scheduled online. and also through that separate call-in line. So it shouldn't be a problem to get our clinics. It definitely was for a couple of days right away after the eligibility expanded, and we apologize for that, but the numbers that we got were pretty amazing. We weren't quite expecting it, but then we recovered and we made some changes, so should be much better now.
And having more vaccine at your clinics has been incredibly helpful, I'm sure, too.
Oh yeah,
Not-
absolutely.
Yeah.
Yeah.
Next question for you, and I think this is actually a really helpful distinction, because in addition to our collaborative community vaccination center, Peace Health also acts as a community vaccination center. And so this question is directly related to that. Can anyone make an appointment at the Peace Health Clinic? Do you require people to be eligible based on DOH guidelines? And do you require people to be patients in order to get an appointment?
So the answer is yes, we do require people to be eligible by the DOH guidelines. We have to follow the state guidelines as a vaccine provider. That's the same for all of us. The answer to the other is everybody, whether they're Peace Health patients, can come to our clinic and make an appointment. That has changed. That's part of what changed early on when we were swamped with people. We were trying to reach out, and we could only reach out to the people we knew about. We were doing some other channels to try and get people who we wanted to get into the vaccine clinic as well early on. But I think during the first month or so, when we had limited vaccines and we were doing outreach, it was more towards people who had already had a relationship with Peace Health, not necessarily just primary care, but any Peace Health provider or the hospital. But that's changed now. Everybody can come. Mm-hmm. And we encourage you to try. We have a lot of openings, and it's been a great experience for everybody who's come, I think.
Good. Yes, we've heard good feedback both at Peace Health and Family Care Network and our community vaccination clinic. So I think we've honed our systems, and they operate very smoothly and efficiently, so we can get people in and out and get more shots in arms as quickly as possible. We've talked a little bit about this, but Dr. Anderson, I've got kind of a hardball for you. Why isn't there more vaccine available, and why is the supply inconsistent? And I think you are feeling this acutely as an organization as well. So I would encourage you to speak freely and share what your experience has been too.
Yeah, I'm good with taking the hardball question. So I think there's multiple layers to this question. The first is supply at a national level has clearly not met the demand. And so I know the number of doses that come into the state of Washington from the federal government has not in any way kept up with the sort of demand that exists based on the eligibility tier. So that's certainly been a problem. We also know at a national level, simple things like weather play a factor in it. So a number of weeks ago, there were storms kind of in the Midwest and such, and those created shipment delays of the vaccines out to the West Coast here. So that certainly impacted supply as well. At the state level, the state Department of Health has made a lot of the decisions about allocations. And I think early on in the process that was focused on hospitals and healthcare systems, certainly who meet the needs of lots of patients across the state of Washington. More recently, as the state has tried to prop up multiple mass vaccine sites, I think that's been a diversion that a lot of doses have gone to those. And so I think that's been really challenging for us in the community. I know for Family Care Network, speaking very personally, we go into medicine to take care of patients and to serve patients. And when there is a tool out there that would allow us to take care of patients, but we cannot get our hands on that tool, it feels like we are failing in some way. And I know for some of our patients, they've expressed, I think justifiably, a level of frustration with how this whole process has gone. And so we are doing our best. I would echo Erica's message that I think for all the healthcare organizations in the community have been ready to ramp up vaccinations once the supply is available. And that really has been the bottleneck from the beginning in this entire process. So.
Yeah. And Dr. Anderson, if I can ask, what do you estimate your capacity for being able to serve patients at your pop-up site or your drive-through site? What do you think that is in a week if you're fully ramped up?
Yeah, probably 1,000-ish patients, plus or minus. I mean, I think as we as we do more of it, we find more efficiencies and can potentially even vaccinate a little higher number than that. So that's certainly what we're targeting. For us, it's a drive-through system, as you know, so you don't even get out of your vehicle. Again, it's pretty darn efficient when we have the vaccine to run it, but it has been disappointing to have that up and running and ready to go. And then currently we're only operated a couple of days of the week because that's what the supply allows. But if that supply picks up in the coming weeks, as you alluded to, Erica, there's been suggestion that will happen, then we're prepared to open that, 5-6 days a week ideally, and run that thing full bore. So.
Great. That's so good to hear. And you can hear from all of our partners, but other partners as well, and pharmacies. We have a lot of capacity in our community to serve Whatcom County residents when there's more supply. And it's encouraging and frustrating at the same time, but we will get there, and it shouldn't be too much longer. I want to address some question, and I'd welcome any of the other panelists to pop up with some of the things that they're doing, and we alluded to some of this as well. But the question is, what are you doing, if anything, to reach the underserved communities in Whatcom County? And I know each of us really have an eye on this and a focus on making sure not only that those who, like seniors who are most at risk for severe illness or death, but also those that may not have other pathways to receive vaccine, may not have the tools in place to compete for the limited vaccine. How are we serving those populations? And I will just share from a Whatcom County Health Department perspective, and then of course ask that other panelists share their information as well. The Whatcom County Health Department has a mobile clinic, and we are prepared to do more with that when there is more vaccine, but we have gone out and vaccinated individuals at adult family homes, which are generally 2 to 6 people at a place. So in terms of efficiency, we may be only able to reach 18 to 30 people in a full day. But we know that without that tool, without that mobile option, they may not be vaccinated. We also know that there are other providers that have mobile vaccine. And we are also working with the National Guard through the State Department of Health, who last week and this week have gone to low-income senior housing facilities and been able to be on site and vaccinate individuals that way. And we plan to continue to work with them to identify those that may not have other pathways to get vaccine. We also have that phone line that I mentioned in order to reach those and be able to connect with people who may not be able to use the internet site for scheduling. And we are doing a lot in terms of outreach and communication. This is one of the forums, but we've also put out a lot of radio ads and print communication for those who maybe don't get their news on social media or looking actively at other media. We often will hear from community partners about gaps or needed linkages. And, when we talk about vulnerable populations or marginalized populations, we don't always have to we don't always have to go there. We don't always have to take all of the steps. There are helpers, there are organizations that are trusted and connected with many of these populations. And sometimes it's just connecting those helpers and those organizations with the resources so they can advocate on behalf of those that they serve. And Shannon can speak of a couple of examples at our community vaccination clinic where we've had some real successes in connecting with helpers and giving some options for people who may be underserved otherwise. So Shannon, do you want to talk a little bit about that? There were just some really heartwarming good news stories from the last 2 weeks, and I know we enjoyed telling stories last weekend.
Sure. It was a lot of fun. Yeah, I can start with the Community Vaccination Center at Bellingham Technical College. So we do offer multiple different ways to try to reach vulnerable and marginalized populations, and part of that is just accessing the appointments. So we have the computer model where you can schedule your appointments online, but we also have the phone number, as Erica mentioned, for folks that are either don't have access to technology or aren't comfortable navigating technology, or who may not have speak English as their primary language. We also do targeted outreach, and we've been doing. The health department has led the way on that for getting folks into our community vaccine center, and those have included people with disabilities, the deaf and hard of hearing, lower income adults, such as Meals on Wheels, outreach to the Russian Ukrainian community, the Black, Indigenous, and people of color. And beginning March 17th, and for this coming weekend's clinic, we're reaching out and doing targeted outreach for agricultural and food processing workers and grocery store and food bank workers. And so those are all really important populations that sometimes have a challenge accessing services and getting needs met. From a story perspective, which to me are the most important and most meaningful, I can speak of a couple that were really touching to my heart. One was a set of grandparents who came in for their vaccines, and they've been trying so hard to get in for a vaccine somewhere without success. And they came in for their appointment, and lo and behold, their grandson, who happens to be an employee of ours, was volunteering that day at the community vaccination center. And boy, it makes me emotional, sorry. He hadn't seen his grandparents in 6 months because of trying to stay socially distanced from his grandparents. And I know he reached back out to me Monday morning after that clinic and said, that he was just so thrilled that in 4 weeks he was going to be able to see his grandparents for the first time in 6 months and spend time with them because they were vaccinated, and how meaningful that was to him. I also did kind of a real kind of point in time estimate when we have 100 patients coming in an hour, and I kind of just looked around the observation area and the vaccinationist area, and I counted like 12 or 15 folks that were there at the time that were over 65 that were there in wheelchairs or walkers. And I made a point to try to touch base with 6 or 7 of them after their experience it was a learning, right? We've just been open 2 weeks. I wanted to find out, was it easy for them to access? Did they have any problem getting in and out? Was it, how was their experience? And did they have any recommendations for us? And all I heard was praise. It was easy to access. It was very fast. Folks were saying we were in and out in 20 minutes. And, observation is a minimum of 15 minutes. So that's a pretty fast turnaround. That they just felt so grateful to be vaccinated and thought the experience was just wonderful, that staff was very helpful and wonderful. I would also say that, my dad's cousin got a vaccine, and he's a Vietnam War veteran and somebody who doesn't always buy into all of this COVID stuff. And so, you both want to get folks in that really want the vaccine, that are really just waiting to get it. But I will also say that when you can convince folks that have a little bit of vaccine hesitancy to get it, that's also extremely meaningful, right? So there's a number. I could go on and on. There's a lot of stories I could tell, but they're very exciting, and they're very heartwarming, and I think are very inspiring for all the folks that are working the vaccine clinic.
Yeah, I want to acknowledge the role of WTA as well in ensuring that some of those with low mobility or additional needs were able to get to our site. That was a real benefit and a real testament to this wonderful partnership that we have. I want to turn it over to Dr. Boxler and then Dr. Anderson on some of your strategies. And this is our last question, so we have a few minutes, and please share any other stories that you'd like to as well. I think this is the stories are the fun part, really, and the reason why we continue to do this work and feel really energized by this work.
Right. Well, I think, Eric, I already went over for everybody some of the efforts that we've been doing in reaching out to the underserved communities who are much more vulnerable. But it's really been great because our role in that has been as a facilitator, and then as really just setting aside time and trying to make it as welcome as we can, taking all the advice from the partners that we're working with who really know the people they're trying to reach. And that effort includes, having a group coming together to talk about best practices, to share what's working here and there. And we're facilitating and bringing those together. I just listen in and learn things, and it's just amazing to hear people out in the community who've been talking to the elder folks in their community and how they're working on getting them in, and how important that is for the whole community to get their elder population vaccinated and protected. So we're also working on some videos that are going up on social media and that we're using, you know, for trusted people in communities to come out and say, this is why you should get vaccinated. So we're trying to work on vaccine hesitancy. And as I mentioned before, we're setting aside multiple hours a week to be able to get those patients in, those community members in, and at that same time, trying to target assistance during our clinic flow for people who may have cultural or language barriers. It's been just wonderful. One of the great things I've heard is that after the first week that our community organizers were out trying to get patients to want to come, they said it was really hard. They were having to work hard. They filled their slots that we gave them, which was great. The second week, because of the experience that those first people had had, and they came back and spoke to their community, spoke to their family, said, it went really well. I'm getting vaccinated. I feel really good about it. Everything flowed much easier the next week. So that it's kind of like that little snowball. Once we can get it started, it's starting to pick up speed, and I think we're making inroads and gaining trust that it's going to be okay when they come. And I can totally understand somebody coming into a clinic where we're trying to do 1,000 or more patients a day. That sounds very overwhelming. But once people are through and see the process and how each person gets treated as an individual, I think that creates those stories that we love to hear out in the community, and drops that fear level a little bit about coming in, and people say, oh, if they can do it, I can do it too. And that's what we want to just keep happening, those ripples going through our community. So I'm really proud of that. It's just, my wife volunteers there, and she was there during the first time that we had our community partners bringing their community members in, and she said it was just a noticeable change. The language was different, the people were different, and it just warmed her heart because, you know, she knew we were getting people who weren't able to set their phone on redial and get onto the computer and join us that way. So
Yeah.
it's been great. It
Thanks
really
for
has
that.
been.
Thank you for that. And, you know, from a provider perspective, we mentioned that BTC and Whatcom Community College are partners in our community vaccination clinic. And one of the sort of neatest things about this partnership is that the vaccinators are nursing students. And I love the idea that their formative educational experience is in an area of such significance and in an area of service and meaning that they're going to carry with them for their entire career as nurses. And it's really exciting to see that as well, that it's both heartwarming to see the gift of vaccine and also the actual giving of the vaccine. It's just a really positive move forward in our community. And Dr. Anderson, I'd love to hear any additional thoughts you have from a Family Care Network perspective.
Sure. I would just end with kind of a request or a plea, and I'll tell the story of annual flu shots, which I'm very comfortable talking to patients about, and then we'll draw an analogy with the COVID vaccine. So a common conversation as a family physician each year was when the healthy, 25, 30, 40, 50-year-old, very healthy individual would come in, and I would say, do you want to get a flu shot? And they would say, I'm not actually worried about getting the flu, so I'm going to decline the flu shot. And I would respond to that by saying, the flu shot is not really about you. It is in part about protecting you, but it's about protecting the community, right? For that healthy 25-year-old, I'm actually not that concerned about them getting the flu. They'll feel crummy for a few days or a week, they'll get better. What I'm worried about is when they have the flu and before they manifest symptoms, or if they have a mild version, they might unknowingly transmit that virus to a more vulnerable patient. That could be the mom of a newborn who touches the same shopping cart that they touched or touches the same door handle. It could be, unknowing transmission to older adults that are vulnerable. And so I think my plea and my request to folks is, as the vaccine eligibility expands, particularly to younger populations, and then eventually 6 weeks from now to everybody, I would encourage everybody to think about getting the COVID vaccine as a community service. It is not so much just to protect you, it's to protect your grandparents, it's to protect the youngsters in the community. I always remind patients we were all babies one day and we were vulnerable, and we all hope someday to be the older individual in society who's going to be a little bit more vulnerable as well. So when you're healthy and you feel like you don't need it, do your part to protect the vulnerable folks in the community. Remember, each individual who gets vaccinated in our county protects those vulnerable people in our community. So please, please, please do your part. If you have the option to get the vaccine, don't just think about yourself, think about the community at large, and please get vaccinated.
Yeah, vaccine is the new mask. So,
Yeah.
Well, thank you all so much. We're about at time. I really appreciate your time, and I hope this has been helpful for our listeners and viewers to learn a bit more about the state of vaccine in our community. Well, we will continue to have more town halls like this and share information. I'm hopeful that next month when we have another community conversation, we'll have much more good news. And in the meantime, please stay safe and stay well. Thanks again.